What is Ativan? Ativan, lorazepam, belongs to a class of medications called benzodiazepines. It is thought that benzodiazepines work by enhancing the activity of certain neurotransmitters in the brain. Ativan is used in adults and children at least 12 years old to treat anxiety disorders. Ativan is also used to treat insomnia caused by anxiety or temporary situational stress. Ativan is sometimes used to treat nausea and vomiting from cancer treatment and to control agitation caused by alcohol withdrawal. Warnings: Ativan can slow or stop your breathing, especially if you have recently used an opioid medication, alcohol, or other drugs that can slow your breathing. These effects can be fatal. Misuse of Ativan can cause addiction, overdose, or death. Keep this medicine where others cannot get to it. Lorazepam may be habit-forming and should be used only by the person it was prescribed for. Ativan should never be shared with another person, especially someone who has a history of drug abuse or addiction. Do not stop using Ativan without asking your doctor. You may have life-threatening withdrawal symptoms if you stop using the medicine suddenly after long-term use. Some withdrawal symptoms may last up to 12 months or longer. Get medical help right away if you stop using Ativan and have symptoms such as unusual muscle movements, being more active or talkative, sudden and severe changes in mood or behavior, confusion, hallucinations, seizures, or thoughts about suicide. Do not use Ativan if you are pregnant. Lorazepam can cause birth defects or life-threatening withdrawal symptoms in a newborn. You should not use this medicine if you have narrow-angle glaucoma, severe respiratory insufficiency, myasthenia gravis, or if you are allergic to Valium or a similar medicine. Before taking this medicine, you should not use Ativan if you have narrow-angle glaucoma, or a history of allergic reaction to any benzodiazepine, lorazepam, alprazolam, diazepam, Valium, Xanax, Versed, Klonopin, and others. To make sure Ativan is safe for you, tell your doctor if you have ever had asthma, chronic obstructive pulmonary disease, COPD, sleep apnea, or other breathing disorder, drug or alcohol addiction, depression, mental illness or psychosis, mood changes, or suicidal thoughts or actions, seizures, an allergy to aspirin or yellow food dye, or kidney or liver disease. Tell your doctor if you are pregnant or plan to become pregnant. If you use Ativan during pregnancy, your baby could be born with life-threatening withdrawal symptoms, and may need medical treatment for several weeks. If you are pregnant, your name may be listed on a pregnancy registry to track the effects of lorazepam on the baby. You should not breastfeed. If you do breastfeed, tell your doctor if you notice drowsiness, feeding problems, or slow weight gain in the nursing baby. How should I take Ativan? Take Ativan exactly as prescribed by your doctor. Follow the directions on your prescription label and read all medication guides or instruction sheets. Never use Ativan in larger amounts, or for longer than prescribed. Tell your doctor if you feel an increased urge to use more of this medicine. Never share Ativan with another person, especially someone with a history of drug addiction. Misuse can cause addiction, overdose, or death. Keep the medicine where others cannot get to it. Selling or giving away this medicine is against the law. Do not stop using Ativan without asking your doctor. You may have life-threatening withdrawal symptoms if you stop using the medicine suddenly after long-term use. Store Ativan tablets tightly closed at room temperature, away from moisture and heat. Keep your medicine in a place where no one can use it improperly. Dosing information. Usual adult dose for anxiety. Initial dose, 2 to 3 mg orally per day, given 2 to 3 times per day. Maintenance dose, 1 to 2 mg orally 2 to 3 times a day. Uses. Management of anxiety disorders. Short-term relief of the symptoms of anxiety or anxiety associated with depressive symptoms. Usual adult dose for insomnia. 2 to 4 milligrams orally once a day at bedtime. Comments. The dosage should be increased gradually when needed to help avoid adverse effects. Clinical studies have not evaluated this drug for efficacy in long-term treatment, e.g., greater than 4 months. Use: management of insomnia due to anxiety of transient situational stress. Usual geriatric dose for anxiety. Older or debilitated patients. Initial dose: 1 to 2 milligrams orally per day, given in divided doses. Management of anxiety disorders. Short-term relief of the symptoms of anxiety or anxiety associated with depressive symptoms. Usual pediatric dose for anxiety. 12 years or older. Initial dose: 2 to 3 milligrams orally per day, given 2 to 3 times per day. Maintenance dose: 1 to 2 milligrams orally 2 to 3 times a day. The daily dosage may vary from 1 to 10 milligrams/day. The dosage should be increased gradually when needed to help avoid adverse effects. When higher dosage is indicated, the evening dose should be increased before the daytime doses. Use of anxiolytic agents is typically not needed to treat anxiety/tension associated with the stress of everyday life. Clinical studies have not evaluated this drug for efficacy in long-term treatment, e.g., greater than 4 months. Uses: management of anxiety disorders. Short-term relief of the symptoms of anxiety or anxiety associated with depressive symptoms. Usual pediatric dose for insomnia. 12 years or older, 2 to 4 milligrams orally once a day at bedtime. Comments. For debilitated patients, an initial dosage of 1 to 2 milligrams/day in divided doses is recommended. The dosage should be increased gradually when needed to help avoid adverse effects. Clinical studies have not evaluated this drug for efficacy in long-term treatment, e.g., greater than 4 months. What happens if I miss a dose? Take the medicine as soon as you can, but skip the missed dose if it is almost time for your next dose. Do not take 2 doses at one time. What happens if I overdose? Seek emergency medical attention or call the poison helpline at 1-800-222-1222. An overdose of lorazepam can be fatal if you also drink alcohol or use other drugs that cause drowsiness or slow breathing. Overdose symptoms may include severe drowsiness, confusion, slurred speech, feeling restless, muscle weakness, loss of balance or coordination, feeling lightheaded, slow heartbeats, weak or shallow breathing, or coma. What should I avoid while taking Ativan? Do not drink alcohol. Dangerous side effects or death could occur. Avoid driving or hazardous activity until you know how Ativan will affect you. Dizziness or drowsiness can cause falls, accidents, or severe injuries. Ativan side effects. Get emergency medical help if you have signs of an allergic reaction to Ativan, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Lorazepam can slow or stop your breathing, especially if you have recently used an opioid medication or alcohol. A person caring for you should seek emergency medical attention if you have slow breathing with long pauses, blue-colored lips, or if you are hard to wake up. Ativan may cause serious side effects. Call your doctor at once if you have severe drowsiness, unusual changes in mood or behavior, being agitated or talkative, sudden restless feeling or excitement, seizures, depression, thinking problems, thoughts of suicide or hurting yourself, confusion, aggression, hallucinations, sleep problems, insomnia, vision changes, or dark urine, or jaundice, yellowing of the skin or eyes. Drowsiness or dizziness may last longer in older adults. Use caution to avoid falling or accidental injury. Common Ativan side effects may include dizziness, sedation, drowsiness, weakness, or feeling unsteady, You will need frequent blood tests to check your blood counts and liver function. After you stop using Ativan, seek medical help right away if you have symptoms such as unusual muscle movements, being more active or talkative, sudden and severe changes in mood or behavior, confusion, hallucinations, seizures, suicidal thoughts or actions. Some withdrawal symptoms may last up to 12 months or longer after stopping Ativan suddenly. Tell your doctor if you have ongoing anxiety, depression, problems with memory or thinking, trouble sleeping, ringing in your ears, a burning or prickly feeling, or a crawling sensation under your skin. This is not a complete list of side effects and others may occur. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800 FDA 1088. What other drugs will affect Ativan? Taking Ativan with other drugs that slow your breathing can cause dangerous side effects or death. Ask your doctor before using opioid medication, a sleeping pill, a muscle relaxer, or medicine for anxiety or seizures. Tell your doctor about all your other medicines, especially valproate, probenecid, aminophylline, or theophylline. Medicine to treat mental illness, or medicine that contains an antihistamine, such as sleep medicine, cold or allergy medicine. This list is not complete and many other drugs may interact with lorazepam. This includes prescription and over-the-counter medicines, vitamins, and herbal products. Not all possible drug interactions are listed here.